Hi, this is Amanda Lane. This is task number 19 for keeping operating records for a patient. We did general anesthesia mass removal with biopsy for a dog today. And we did, so this is all of his records that we keep for them. So starting with their, we start with a treatment plan, an estimate that the client signs, stating that it is okay for us to anesthetize their animal and that they understand what their the risks involved with that. Next, we put together their anesthetic chart based off their weight. So this is their check-in sheet, has all of their information on there. So we build a drug calculation from there. And on this drug calculation sheet, it is based off their weight. It does obviously calculate that in kilograms, and it has all of our pre-anesthetics that we use and all of our induction drugs that we use. For this dog today, we did use as a pre-anesthetic hydromorphone 2 mg per mil. And so we went ahead and I marked that in our control drug log. So what we have here is we put in here the patient's, the date, the patient's last name, first name, species, the amount used, the bottle that it was taken from, what we're using it for, PA, and then we are subtracting that from our balance. And then the doctor and the technician initials that. Also, we did that for our induction, and our induction drugs were midazolam and propofol for this patient. So I did go ahead and mark the midazolam, and the propofol is not in the controlled log, but the midazolam is, so that is listed here with the balance as well. We are a paperless mostly practice, so everything that all of our surgical records, they are, I printed them out today, but they are all transferred to our database via a chip, and so everything is electronic. So this is our actual, this is kind of a summation of the surgery report that we get printed out at the end of our procedures. It includes the patient information, the procedure being done, the date that's happening, the doctor, the technician, the ASA status, the patient's weight. We have all of the vitals, the temperature, the heart rate, and the respiration rate. We have also the mucous membrane color, this capillary refill time, the packed cell volume, the total solids, BUN, glucose, everything that we ran as a pre-surgical blood panel is included on here. Then we move on to our pre-anesthetics, which was the hydromorphone, excuse me. And then we list our inductions, the midazolam and the propofol, the doses that we gave, the routes they were given, and the times, and what they were used for. Next on here is the fluids. So we run our surgical patients usually on Normasol R, and the rate is calculated on our surgery form down here in our maintenance fluid calculator. So his was 186 mils per hour. And then we do put the total at the end here. This also details the ET tube size, the breathing system that was used, the inhalant, which was isoflurane, and then the body position that the patient was in during the procedure. And then it shows the graphical information for all of our physiological parameters that we are monitoring during the procedure. It gives the total procedure time, and then it gives down here just an open note section, and we are able to detail how the patient recovered, because we like to know if it's stormy or if it's uneventful. We do, so all of this information will get put into the system, as I said, since we are typically mostly paperless, but I wanted to print these out just to kind of detail the information that we're given. So this is from our SurgiVet for the procedure, and it is checking every 5 minutes the vitals, and that is giving us our pulse rate, our rhythm, our blood pressure, systolic, diastolic, and mean. It is, I tried to do the temperature, the gauges weren't working very well, so I was just doing manual temperatures for him. We've got our Entitled CO2, our inspired CO2 respiratory rate. It gives everything and it details it every 5 minutes so that we know how they're doing under anesthesia. And then this is just kind of a breakdown of all of that there. So it kind of gives us on a bigger scale what our oxygen saturation was during the procedure, the pulse rate during that, and it gives that every 5 minutes as well. This is our blood pressure graphical trend. And that kind of gives us, again, every 5 minutes. This is our pulse rate. So that, again, just breaking it down from the form. Our end tidal, every 5 minutes. This is our inspired CO2 graphical trend. And then finally, the CO2 respiration rate and graphical trend. So it's just kind of a breakdown of all of our forms. And all of this does get put into the patient's medical record for that procedure for that day, so that if you need to go back and check anything medication-wise or treatment-wise, how they recovered-wise, all of that is put in the record for easy viewing.